Hello everyone. So today we are going to discuss about acute diarrheal diseases. Now diarrhea is defined as a condition where there is sudden change in the consistency and the character of the stool mainly, but another way of defining it is that there is increased frequency of stool output more than 3 times a day. Now, there are different types of diarrhea. The watery one caused by cholera, rotavirus, and E. coli. The uh, uh, bloody diarrhea that is caused by Shigella. Persistent diarrhea more common in AIDS. And here we will directly talk about the agent factors. Now, 20 to 30% of cases are idiopathic, where no pathogen is found, and these are the important pathogen which we will talk about. Now, rotavirus is one of the most important cause in children, which is responsible for 15 to 25% of cases of diarrhea. It causes a severe dehydrating diarrhea in children less than 5 years, and now three-fourth quarter of the children are infected by rotavirus in a age less than 12 months in developing countries, whereas in developed countries the same number of children are affected at a age of 2 to 3 years. Now, at the age of 6 to 24 months, the child may develop a severe rotavirus gastroenteritis, and these rotaviruses are excreted in a large amount in our excreta, that is 10 to the power 12 particles per gram. Mode of transmission in the case of rotavirus is through fecal-oral route, okay, and contaminated fomites. Another important cause is a bacteria, that is enterotoxigenic E. coli. Now, this is the most common cause of the traveler's diarrhea worldwide. And the important thing is, it does not penetrate the bowel mucosa compared to the salmonella or other bacteria. It releases a toxin, that is a labile toxin and a stable toxin. Here the labile toxin resembles the cholera toxin in its properties, okay? And this enterotoxigenic E. coli is it is transmitted through contaminated food and water, and is an important cause to consider while traveling in an endemic area of diarrhea. Another bacterial cause is Campylobacter. Okay, it is a S-shaped gram-negative rod that causes enteritis and diarrhea in 10 to 15% of cases, and how it causes the diarrhea is still unknown. Another important cause is Shigella, which causes a bloody diarrhea and it has a high mortality rate. Salmonella and cholera we will study in a separate topic. Okay. Now, Cryptosporidium is an important cause of persistent diarrhea with wasting and weight loss in a patient of AIDS. Now, one more thing we need to remember is that if a AIDS patient present with a persistent diarrhea that lasts for more than 30 days, this is a clinical sign that help in diagnosis of immunodeficient condition of AIDS if other clinical signs are also present. Now, one more thing is that there are non-digestive origin cases of diarrhea, means where there is not involvement of our GIT. This may be through an infection through air, nose, or throat route, okay, or a respiratory infection or a urinary tract infection that may cause our secondary gastrointestinal tract involvement leading to diarrhea. Now, congenital causes may be if a child is born with inborn error of metabolism, or there is an enzyme deficiency that is leading to inability of digestion of the food particles leading to a diarrhea. So these are important agent factors that we need to remember. The most important one being rotavirus, enterotoxigenic E. coli, and Campylobacter. Okay, going with the host factor, um, the child within the age of 6 months to 2 years is the most prone one. Now, why this is? Because this is the age when the active immunity that the child has gathered from the maternal blood is weakened, and now the antibody level is reduced that was received earlier. Another thing that is important is this is the stage when child starts to crawl and start exploring the things, okay? So this is another reason why this age is more prone for acute diarrheal diseases. Third reason is this is the age when there is change in the milk, we tend to use milk substitute, maybe like cow milk or infant feeding formula. Okay, so these may lead to contamination, and these are important cause, uh, host factors that we need to remember. Another one is that there is a vicious cycle that may occur. Means if there is a child that is suffering for malnourishment and he develops an infection, because of this infection in a malnourished patient, the child may suffer from diarrhea. And if the child suffers from diarrhea, then again the child will be more malnourished. So this vicious cycle goes on if the child is malnourished. Now, environmental factors include, we need to remember that the bacterial type of diarrheas are more common during the summer season, and the rotavirus diarrheas are more common during the winter season. The mode of transmission is fecal-oral, that may be waterborne through the water, foodborne, or the direct transmission, means through the fingers or dust, that child are more prone during this age of 6 months to 2 years. So this is what we need to know about epidemiological determinants. Thanks for watching.